Namaste, I am Dr. Tirthankar Mohanty. I am a nephrologist in Manipal Hospital Ghaziabad. Today we'll be talking about CKD 5 stage 5, that is chronic kidney disease stage 5, how it is diagnosed and how it is treated. Chronic kidney disease basically means that if a person is having some evidence of kidney disease for approximately 3 months, then it is considered chronic kidney disease. So how do we assess that patient has kidney problems, evidence of kidney damage? That is by doing two tests. One is looking for protein leak in the urine. Normally an individual passes up to 30 milligram albumin per day through urine. If it exceeds that, then that is called abnormal, that is called albuminuria. Second is looking for something called, estimating something called glomerular filtration rate. Glomerular filtration rate, which is shortly called GFR, is calculated from a simple lab test called serum creatinine. But what does it mean? Our kidneys have small filtering units. You can imagine that there are very tiny filters within your kidneys. They approximate 10 lakh. They are approximately 10 lakh in number in each kidney. So altogether you have 20 lakh such tiny filters. When the blood passes through those, whatever the filtrate comes out taken together, that is considered the glomerular filtration rate. After making a diagnosis of CKD stage 5, that is when your GFR is less than 15, it is considered stage 5. And when a person's GFR is more than less than 60 ml per minute for approximately 3 months, then only he is considered to have CKD. And the CKD is then after classified according to the glomerular filtration rate level, and when it is below 15 ml per minute, then that is considered CKD stage 5. And CKD stage 5 is a life-changing diagnosis for all. Some people know that they have some kidney problem and eventually progress to CKD stage 5, while some people are diagnosed with CKD stage 5 when they present to their nephrologist or doctor for the first time. CKD stage 5 basically means that the kidney function has deteriorated to a large extent, and there is a possibility that there will come a time when the filtering function of the kidney won't be sufficient to filter out all the toxins, and a person will require something called kidney replacement therapy. Kidney replacement therapy are 3 in number. The only perfect replacement of a kidney can be a kidney. So you should aim for kidney transplant if it is possible. But if for some reason it is not possible, then a person with CKD stage 5 is left with 2 options. The first one is called hemodialysis. The second one is called peritoneal dialysis. In hemodialysis, the person has to visit a dialysis center 2 to 3 times a week. There is a machine called hemodialysis machine there, which takes blood from the body and filters it and then returns it to the person. And this process requires access to your blood pipes. So basically it requires a vascular access, and vascular access are commonly of 2 types. The first one is called AV fistula, which is basically connecting a vein to an artery, and arteries are blood pipes with very high blood flow, and when a vein which is typically having a low blood flow connected to it, the blood flow within the vein increases. Ultimately, the vein wall becomes thickened and the blood flow becomes very high. So it becomes easier for the dialysis nurse or technician to puncture that dilated vein to take the blood, which will be carried to the machine, and there it will be filtered and returned back to the patient. The second option, that is peritoneal dialysis, entails insertion of a pipe made of silicone into the tummy, through which a special 2-liter special fluid is instilled into the abdomen, which usually comes in 2-liter bags, and then after 4 hours the fluid is drained out, and when the fluid comes out, it takes out all the toxins of the body. This process is done every day throughout the week. So this is called the another name for it is continuous ambulatory peritoneal dialysis. There is a fourth option which is not for all, but if for some reason you are unwilling to start dialysis, or you have many non-kidney medical illnesses which makes gain of any benefit out of dialysis procedure minuscule, in that circumstances you opt for conservative management and your doctor gives some medicines to minimize your symptoms and he keeps you going as long as possible. Whatever I have told you so far applies to chronic kidney disease stage 5 only. If you are diagnosed with chronic kidney disease at an earlier stage, depending on the disease, depending on the damaging insult, medications can be provided to slow down the kidney damage. And you should also not think that the moment your GFR drops below 15, you are subjected to dialysis. This is also not true. The decision to start dialysis is a complex one. The doctor takes many things into considerations like how badly symptomatic you are, how bad your blood tests are. He looks not only at your creatinine values but also at your hemoglobin, albumin, phosphate values, potassium values, and he also takes into consideration your preferences. So there are multiple things considered before you are asked to undergo dialysis. Thank you.